Hi Cornerstone, how are you? It's me, your doctor, Dr. Sabine Elisee, board certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. If you're watching this video, well, that means it's time for us to learn again in our monthly healthy wholeness formulas. So I want you to go ahead and grab a paper, pen, grab your family members so we can learn about something new that I know is going to be beneficial for you and your health. And this month, what are we going to be speaking about? We're going to be speaking about exactly why vitamin D is so important and roles it plays. Don't worry, I'm not going to get too technical. I'm not going to make this something as if I'm teaching a medical school or students, but I want you to understand so that you can know why it's important for you and what role it plays in your health and well-being. Are you ready to learn? Because I am ready to teach. Ready, set, let's go. So let's look at 3 things that I want to focus on today in this video when it comes to vitamin D. 1, anti-inflammatory properties. 2, antiviral properties. And 3, it being a fat-soluble vitamin, and why that is so crucial and critical and why that changes for each person. So let's go ahead and start with the antiviral properties, because I think now more than ever, that's the one that's more important. So antiviral, viruses versus bacteria. What's the difference between a virus and a bacteria? Bacteria infections, we have antibiotics to get rid of them. That's why bacterial infection, not too big. Viruses, well, we don't have antibiotics to get rid of them. Viruses, truly, we just treat them symptomatically. In other words, there's medications that we could kind of take to control how the person's feeling if you get sick with a virus. But unlike bacteria, there is nothing that really kills a virus. So when you are infected with a bacterial infection, you take an antibiotic, we kill it, done. When you have a viral infection, what we do mainly is kind of wait, treat the symptoms, let it run its course. So when I talk about virus, what are you thinking about? 3 of the ones that we're seeing more commonly in this season of the year: flu. Flu virus is a virus. Pneumonia. Pneumonia is a virus. And of course, our all well-known, not so favorite coronavirus. It is a virus. That's why there's so many people talking about vitamin D. And even in the hospital, when someone gets admitted, they're giving them vitamin D through the IVs in order to help fight that virus. So vitamin D holds these antiviral properties. So we are seeing that individuals who have adequate levels of vitamin D, so that means you are at least at 30 or above, or you have even higher than that, you have a stronger ability to protect yourself against a virus. It's almost like a force field. And this isn't something that's just new. We've seen this over time. The literature has been present ever since I was in residency. That's about 10 years ago. But now with the new COVID and coronavirus, we're seeing more and more that individuals who have adequate levels of vitamin D are higher than what they should be. One, when they get infected, they really don't feel anything because their body has the ability, the antiviral properties to fight this virus, and they're able to get rid of it or just not get it altogether. So 1, we take and you take, and I give you and recommend for you to take your vitamin D every single day because it has these properties of antiviral. So based on the numbers that we did in here in the lab, because remember, medicine is not one size fits all, I will know how much vitamin D that you should take. So the next question that someone may have, well, Dr. Elise, how much should I take? And I'll tell you in all honesty, just at least grab what is over the counter, take it daily to be that, so that could be your starting dose. And then if needed, we'll increase it or come in and of course we'll check your levels, but don't worry, I'm checking your levels regularly. So 1, vitamin D has our antiviral properties. What's our second one? We said anti-inflammatory properties. So anti-inflammatory, it's stopping the inflammation. And when you think about inflammation, it kind of goes hand in hand with antioxidants. I've known you'll know that you've seen those commercials. I know my patients are so into their health. They're reading, they're listening, they're understanding. They see all this information about this is an antioxidant, this is an anti-inflammatory. And why do we say that? Anti-inflammatory is what makes us look like we're aging. It's the inflammation process, but not just on our outer skin, but also inside too. Cellular information, cellular when it gets oxidized, the things that are occurring inside of our body. And just like we see with a lot of infections, when someone is sick, there is inflammation that occurs in the body, and that's a lot of times what's causing you to feel sick and and throw your numbers off when it comes to your blood work and your labs. So here's another way I could describe anti-inflammatory, antioxidant. I want you to think about a nail that you've had, but now that sat outside and now that nail is rusted. You know, when the nail turns to that yellow rust color, well, what's happened is that it's been oxidized. That nail doesn't work the way it should work anymore. No one is going to use rusty nails to build up the structures of their house or whatever it is. Well, that's the same thing that is occurring when we speak about oxidation in the body and this inflammation in the body. And that's why vitamin D plays its role to stop that oxidation and stop that inflammation. You know I'm a little bit of a nerd, so I get excited about this. So vitamin D has those anti-inflammatory processes as well too, right? So we spoke about antiviral. We gave you a great example about the rusted nail that we could keep from getting rusted, like in our bodies. That's why we spoke about the anti-inflammatory processes. And then finally, number 3, I want you to help you understand that vitamin D is a fat-soluble vitamin. There's a couple of vitamins that are fat-soluble, A, D, E, and K. D is the one we want to talk about. So something that someone says a lot is that, well, vitamin D, I drink milk, I eat a lot of dairy. That is called vitamin D2. That's not the one that's giving us what we need. The one that's giving us what we need is D3. Vitamin D3 we actually only get from the sun. And I know anytime you go outside, I'm going to tell you to put on sunscreen to protect your skin. So that means the sun is not going to be able to penetrate the skin the way you need to. And if you have increased melanin in your skin like me, so if you're one of my black brothers and sisters, so then that means also for some reason the light doesn't penetrate our skin the way it does, the way it should. And that's another reason why we don't get the vitamin D that we need. So what does all of that have to do with the fat soluble vitamin? So we already are dealing with 1, we only get it from the sun. 2, if you have increased melanin in your skin, then you're not going to get enough in. Or if you're not spending these extended amount of time outside in the sun, you're not going to get it in what you need in, because then it's going to be more sun damage. But now here's a third component of it. If you're an individual who's overweight, if you're falling into the obesity category, if you have more fat cells in your body, when you take vitamin D, that vitamin D, because it's a fat soluble vitamin, that vitamin D gets sequestered, or it's hanging out mainly in those fat cells, never really getting into your bloodstream. So those are some of the reasons why we see people will be taking a lot of vitamin D. They'll have it in all of their supplements, their shakes. Everyone is big on this now, but they'll still see their vitamin D level is just hanging out at 30 or only at 20. That's why, because vitamin D is a fat-soluble vitamin. So if you have increased fat cells, then you're gonna have to be able to take a little bit more. And then, like I said, this is something that I'm always looking at in your blood work, whether I'm mentioning it to you or not, but I feel like I do, that why we need this vitamin D. So I don't want you to just take it just because. I want you to be able to know why you're taking it, know why it's important, and then for you to talk to your friends and family to know, I'm not just doing this because that's what they said. I know why I'm taking this. And once you know why you're doing something, more than likely you're gonna be doing it more. So our vitamin D, yes, you could take it daily. You could take it weekly. Usually when we do it weekly, it's because we need you to have a loading dose. And then even our pregnant women who are listening there too, your vitamin D as well too is actually helping your fetus, helping the baby in a very early stage. There's so much research out there in regards to low vitamin D and insulin resistance, low vitamin D and multiple sclerosis. It's just a beautiful, easy vitamin for you to take. So this is your reminder to make sure you're taking your vitamin D today. Why? Because it's an anti-inflammatory, it's an antiviral, and it is a fat-soluble vitamin. So if you're a little bit more chunkier, I need you to make sure you're getting a little bit more. All right, that's all our teaching for today. Just like we said, nice, sweet, quick, and to the point so you can understand what you're doing. Of course, if you have any questions, don't hesitate to call me. I'm your doctor. You know how to reach me. And I look forward to seeing you soon here in the office. Take care. God bless. Bye.